will compensate that. So we'll start with aphorism 4, which says, he is likewise a preserver of health if he knows the thing that derange health and cause disease, and how to remove from them from persons in health. From Organon of Medicine, edition 6 by Samuel Hahnemann. Then we'll read aphorism 5. Aphorism 5 says, useful to the physician in assisting him to cure are the particulars, the most exciting cause of the acute disease, as also the most significant point in the whole history of the chronic disease, to enable him to discover its fundamental cause, which is generally due to a chronic miasm. In this investigation, the ascertainable physical constitution of the patient. This is very important because when we see a patient, we should look for the physical constitution of a patient. That Hahnemann writes it in the first sentence, especially when the disease is chronic. This is very, very important for our case-taking analysis. His moral and intellectual character, his occupation, mode of living and habits, his social and domestic relationship, how he is with his colleagues, how he is with his neighbor, how he is with his friend, how he is with his family member. This is very, very important in IPR. What is IPR? IPR is interpersonal. This is very important for case analysis. His age, yes, you know, the age is also very important, and the sexual function, etc. No, etc. means we have to take this mental symptom in the end. It should not be taken in the first case itself. Or if you get it, it's okay, no problem. But the weightage that you have to put in case taking is ascertainable physical constitution of the patient. So taking into that consideration, this is very important of our case taking. Now, my today's topic is insight into different Materia Medica books. Now, why I have chosen this topic is because we are not reading Materia Medica books. When we started our college, we read, especially I have read most of the books in my library, college library. I can say that. So we have to start with basic books, which are very, very important for our case analysis. Starting from Materia Medica Pura, then having guiding symptoms, which is very important. Then comes the encyclopedia, which is very important again. Then comes many, many smaller books that I'll just enumerate in this session. First, I would like to tell you something about very interesting book which I have in my papers. Are you all able to see my face? Face दिखे?
No, sir.
मुझे ये बुक बताना है, कैसे बताना? वीडियो ऑन तो से वीडियो ऑन. मुझे ये बुक बताना है क्योंकि दिस बुक इज वेरी वेरी इंपॉर्टेंट व्हिच आई फाउंड very useful in our practice, and we are missing this book, unfortunately. How I should show? Okay, let's. This is it? Are you able to see this book?
Sir.
No, sir.
हाँ बताओ. You have to see from.
Logica.
Are you able to see this book?
No, sir.
Fine. No problem. The book is Handbook of Materia Medica and Homeopathic Therapeutic by T.F. Allen. In this, I will show you some very important remedies. उसको स्क्रीनशॉट करके रख सकते हैं. It is visible in one of the folder that if you can scan that. It is from Prima, no? Okay, we'll start with one interesting remedy which this book says. We have to share the screen. The screen says. Screen sharing. This is this book. Sorry for the delay. Are you able to see this remedy from T.F. Allen's handbook, Materia Medica?
Yes, sir.
The book,
Yes.
book has given wonderful remedy where he has shown you a clinical aspect of acetic acid. Are you able to see? Yeah. So clinical aspect of acetic acid given by T.F. Allen, where he writes general anemia with a waxy skin, anasarca, emaciation, and sweat, delirium in low fever with profuse sweat and diarrhea, membranous proof with bright red face and perspiration. It should be given in anemia of nursing woman. Are you able to see this symptom, clinical symptom of acetic acid? You can take a screenshot. The importance of acetic acid I have seen in one of my cancer patients where the patient has come for swelling, generalized swelling of the face with thirst. There was too much anasarca and lot of emaciation and sweats were there. Sweating was there. So this remedy, when we read from T.F. Allen, give you a proper picture of clinical understanding. So these books are very valuable when you read in a clinical point of view. Now I'll show you another remedy, Asculus hypocasting. See, where it writes clinical, it is valuable remedy for follicular inflammation of the posterior wall of the pharynx. With the symptom above emphasized, it is compared especially with phytoleca. Dear student and practitioner, if you are reading this book in a proper manner, you will get many clear understanding of the clinical aspect of this drug. I'll show you this symptom again. Are you able to see? Say yes, Nitin.
Yes, sir.
See the clinical value for follicular inflammation of the posterior wall of the pharynx with symptom above emphasized is to be compared especially with phytoleca. So this book gives you a comparison with phytoleca where we have to differentiate Aesculus in the condition of follicular inflammation. Second clinical part, which he has given for Aesculus. The action of this drug on the liver associated with engorged portal veins or portal circulation, especially in large hemorrhoids. कौन होगा जगह नहीं, पानी करनी, पानी नहीं, पानी बस नहीं। तो अंदर फेसबुक चालू कर, especially in large hemorrhoids is extremely marked. Are you able to see this? This is also very important understanding given by
Yes,
Allen's
sir.
handbook. Further, what he writes: for protruding purple piles with the symptom noted, drug has been found extremely valuable, and for this trouble it has won greatest laurel, especially associated with them. And almost characteristic of the drug are the severe pain in the sacrum and small of the back and fullness in the region of liver. Now I will show you one another book which is very important. This is George Royal. Have you heard the name Royal? Royal George
Yes,
Royal
sir.
book. Yes, thank you for knowing this remedy. So we'll open. Aloe. Where he writes, are you able to see this? Hemorrhoid, swollen, sore, weakness of sphincter. Where George Royal writes about the hemorrhoids. Now the characteristic of George Royal Mathematical is it gives us the location and direction. What is the location given for alloy? Is vein, liver, intestine, rectum, and female generative organ. This is very important. Then the aggravation heat of summer and early morning. Ambulation, cool, open air. This is given by Boger also. You know about Boger, right? Sphere of action which Boger gives. But Boger doesn't give the stage of life and constitution which the George Royal book gives. See how the beauty of mathematical comes. Are you understanding or being getting it what I'm saying? This is very, very important,
Yes,
the
sir.
role of books in our understanding. Then I'll give you Allen skin. Allen therapeutic of skin. Do you know which is the drug for ringworm? Who will tell me drug for ringworm?
Sir, Basilinum.
Very good. Then second,
Uh,
tellurium. Very good. Pachi, Biju,
Tellurium.
practitioner Hardik sir. Hardik sir.
बोलो
Ringworm,
राजीव भाई
ringworm remedy. Hardik sir.
टेरिलियम
Tellurium. Very good.
Stocks.
Cross talks. Very good. Do you want
हम
to
तो
see
सेपिया
another?
सेपिया इज आल्सो
Yes. Do you want to see another
CPN
remedy?
single spot. CPN single spot, sir.
Correct. Very good. Now, very.
અને
Now see this book, Allen's Skin Therapeutic. Are you able to see?
हाँ बोलो मनोज भाई
See, objective skin rough, dry all over, dry bend like crater in rings, ulcer swelling
फोन
of
आवाज
the joint, sensation on the skin, forehead as if too tight, aggravation, passive motion and tough, use in snake bite, expulsion of splinter from the skin, ringworm similar to sepia and tellurium. Hardik sir, see, Anagalis arvensis. This is the remedy that I use in my practice. Anagalis, see Anagalis. We are missing this remedy and we are not learning from this book. So this is important of this book. Dear student, are you getting it? Okay.
Yes, sir.
Now, what is the main famous symptom of Aloe secotrina? Mind symptom. What is the mind symptom of Aloe secotrina? Who will tell me?
Sir, insecurity.
Very good. Very good. Please tell me more. Tell me more. Famous mind
Sir,
symptom
very
given.
political. Sir, very political.
Political. Very good. Any other symptom do you know? Which is given in synthetic repertory. The very important symptom is fraternize. Do you know what is meaning of fraternize?
Fraternize with the whole world.
Fraternize. Yes, whole world is my family. Where you find this remedy, or where you will find this symptom, in which book you will find?
Anila.
Where it is written? Who will tell me where it is written? Chalo. Synthetics માં આપી દીધું છે બરોબર છે પણ where it is written? તારું નામ શું છે બેટા?
Sir, Franz Vermeulen.
फार्मर्मुलेन में सब कुछ दे दिया है अनफॉर्चुनेटली, पर फ्रांस वर्मुलेन ने कहां से लिया है? फ्रेंच वर्मुलेन, वेयर इट हैज टेकन फ्रॉम?
From repertory.
No, he has taken from Allen Encyclopedia. So I like to show this symptom. See, are you seeing it? मिला? मतलब कोई यस भी नहीं बोल रहा है, मुझे पता नहीं चल रहा है.
Yes, sir.
Yes, sir. Yes, sir.
मतलब मैं साइड इफेक्ट्स. Mary
sir.
self-contented, fraternize with whole world. It is given in Allen Encyclopedia. और दूसरी बात बताऊं आपको, where he writes very interesting symptom is anthrophobia. What is anthrophobia?
Fear
Anthrophobia.
of humans.
Yes. See, Nitin, where it is given? See, Allen's Encyclopedia, anthrophobia. Aloe secotrina belongs to which family? Nitin?
Liliaceae.
Very good, Liliaceae. And every plant kingdom has the two pole or polarity you will see. देवांशी सारी છે તો ખરાબ બી છે, right? Are you getting?
Yes, yes.
This is important of Materia Medica. This is the beauty of this Allen Encyclopedia. Now I'll tell you very interesting remedy, stramonium. Stramonium has very interesting symptom given only in Allen Encyclopedia. That is, can anyone tell me? Stramonium has very interesting symptom, that is erotomania before menses. A girl or a woman has the erotomanic mania symptom before menses. This is given in Allen Encyclopedia. This is the book where everyone takes everything from that. It is from the Solanaceae family, where the solanine is very important, and it is in the subclass. Which subclass? Do you know anyone?
6.
Very good. It is subclass 6 according to Sankaran's way of understanding. Right? Now I'll show you very interesting again. Another book which I have learned a lot. The older books. Again, George Royal. Now we'll see antim crude. Now ammonium car. Okay, ammonium car. Royal antim crude. This one, ammonium car. Okay. Now I'll tell you what this ammonium. This ammonium car, where he writes heart and circulation, respiration, organ, blood, weak, fullness, oppression. Do you know the very important symptom of ammonium car by Kent? Who will tell me? Ammonium car from Kent. So I'll show you very interesting symptom of ammonium car, which I have solved in my practice. They have very interesting mind symptom, that is sadness. Sadness when they are sad.
Cloudy weather.
Very good. They are sad in cloudy weather. This is very important symptom of ammonium car. Sadness, cloudy weather. See, are you able to see ammonium car from Kent?
Yes, sir.
Only one symptom, only one remedy given in Kent's repertoire. Now I'll show you another remedy, which is the remedy which has dream, nightmares while lying on the bed. My
Sulfur.
Sir, Kali Brom.
Sir, sulfur.
Who is saying sulfur?
Sir, Kali Brom.
Dara.
Sulfur is the right remedy with two other remedies, that is Cardus marianus and guaiacum. Guaiacum. Very right. So I'll show you the remedy. Can mind sleep sleep. Sleep. Dream. Dream. You have to rule this sulfur by this dream. Very important dream. Nightmare. Dream nightmare. Nightmare lying on bed. Dream nightmare lying on bed. I am going slow because we have to understand each phenomena in a very acute manner. Yeah, this is the thing. Are you able to see? Sulfur, Cardus marianus and guaiacum. दिखाई दे चलो. Cardus marianus is from which family? Cardus marianus is from Compositae. It is from Compositae. Cardus and marianus. Cardus marianus. Marianus matlab the vein which are in a line manner or lateral. I like to show you the video of Cardus marianus. Are you interested to see? Yes.
Yes,
Yes,
sir.
sir.
Yeah, I'll show you the
Yes.
Cardas Marianus plant, where you will remember night, dream, nightmares, lying on back. This is very, very important, where I have solved one case. So Cardas Marianus plant, we will see the plant of Cardas Marianus. Video. This is the plant. Sound नहीं आता है.
Hi, my name is Mark Lenz. I'm with the University of Wisconsin Extension, and I'm here to talk to you about how to identify fuller thistle. It's one of our biennial thistles. It's very common throughout Wisconsin. This plant is difficult to distinguish from other biennials. But the key component is that we differentiate the biennial thistle versus the biennial thistle cancer thistle. And it's across all biennial thistles. Thistle is common to a lot of different areas, but mostly on roadsides, pastures, and areas that I dislike from others is by looking at several key characteristics. First, if we look at we see that it is quite divided.
It is quite divided. See how the plant is divided. This is very important for Cardas Marianus thistle.
As we do see, with some small spines on it up and down the stem. If we look at the hairiness of the leaf, we see the upper side of the leaf tends to be not hairy. Maybe some of the older leaves will have a few small hairs. But if we flip this over, tiniest and all the stems are actually substantially compared to some of our other business. Another good key identifier.
See, this is the difference.
It's similar to musk thistle, and so often you'll see plants that have extended on the midrib of the underside of the leaf, spines on the stem, and a small to an inch in diameter should help you identify this biennial thistle.
This was Cardas acanthoides, right? This is another thistle. Musk thistle. It is from the Asteraceae family. Sunflower family.
Large branches down to produce the flower. Sometimes the leaf margins have a frosted or
I think
these are deep low with yellow spines on the margins. The leaves extend up the stem and begin to look like.
See, the world of plants are wonderful. We can work on many plants which are unknown for our prescription. In near future, I'll talk more about plant kingdom with classification. Today, as my topic is on the Materia Medica books, I'll stick to that topic. Now, something else. Are you able to see the slides?
Yes, sir.
Come to
Yes, sir.
something different for cure. This I have written for process of cure. One should find the pathology has to be considered first in the process of analysis and evolution of the case. Very, very important. Many people or many homeopaths doesn't take pathology into consideration. We should take pathology into consideration in the process of cure. Second is multiple remedies are required in many of the cases where we need at least 3 to 4 remedies for our prescription. It is not just the classical one remedy prescription. We should treat the patient one by one. It is not a zigzag cure. It is the stepwise cure which is required. Third, which is required is anti-miasmatic remedy, where the miasm has to be diagnosed at first important. which is the predominant miasm in the case? Psoric, then psychosis, then syphilitic. In near future, I will tell you about, tubercular, yes. Ringworm miasm, definitely I'll talk on that. You know the latent psoric symptoms are given where, it is given in Materia Medica Pura. These are the pure symptoms which Hahnemann writes. Okay, the fourth, which is very important, is acute or smaller remedies like Cardas marianos. And you can't believe it is a very good drug for gallstone. It is very good drug for any liver condition. It may be a hepatitis, it can be a cancer of liver. Then start with Cardas marianos in mother tincture. And it works along with your constitution treatment. Mother tinctures, even the Hahnemann used very well. Do you know which is the remedy in mother tincture for angina pectoris? Who will tell me? We will be interactive session should be there. So, which is the
Cratatus.
used for angina pectoris?
सर
Cratatus.
लेट्रोडेक्टस
Leptodectus. फिर दूसरा क्या?
Cratagus.
Cratagus.
amyl nitrosum.
Amyl nitrosum. Very good. Any other remedy?
Cactus.
Cactus. Okay. I'll show you one remedy which is very important. And the remedy is bryonia. Do you know that bryonia is very good drug for angina pectoris? In boric materia medica. Are you able to see boric materia medica?
Yes, sir.
Yes, sir.
See, angina pectoris use mother tincture. Boric writes. बोरिक पागल था यार, उसने लिखा है ना, बोरिक है वो. बोरिक मतलब भगवत गीता है, उसके बिना हम कुछ नहीं कर सकते. मतलब authority has given mother tincture. First thought should come in your mind should be bryonia, because bryonia is from which family? Cucurbitaceae. Very important plant kingdom remedy, cucurbitaceae.